Fertility is a very difficult area for people to discuss, sometimes even within the relationship, let alone with strangers or friends or doctors, whoever else it may be. And there's a lot of pressure that people are put under, particularly once they get married. Why haven't you two had children yet? And the public don't realise how painful and how hurtful that can be. So today I'd like to talk a little bit about Chinese medicine and the approach that we take to fertility, because quite often, whereas Western medicine would say there's no reason for the infertility, I could do a diagnosis on somebody who comes with back problems or with digestive problems, and in my mind I could be thinking, if you want to conceive, I think you're going to find it difficult. So I find with Chinese medicine we have a lot more answers, a lot more explanations, just because of looking at the body in a radically different way to Western medicine. We do take a holistic approach, and so when you come for a consultation with regard to fertility, I'll ask you all sorts of questions about your nutrition in particular, your lifestyle, your bowel movements, obviously your gynae history, but your overall medical history. How healthy have you been? What have you been exposed to? Where have you travelled to? What weather do you like? Because I'm sure most people have heard of yin and yang, and in a very simplistic way, it's important to know yang often represents heat and yin is more to do with cold. And sometimes it's that type of energetic temperature in the body that can have a huge impact on whether or not you're conceiving. So we use a combination of acupuncture, herbs, moxibustion, maybe electroacupuncture, which is a bit like, it feels like a TENS machine. It's nothing like as drastic as it sounds. We use cupping, and because I'm a herbalist, I might prescribe herbal remedies that are tailored to your needs. And obviously nutritional advice, because in Chinese medicine, nutrition is at the heart of everything. So we tend to take a more rounded approach to your overall health, as well as looking at what's gone wrong that relates to fertility. This is a particular area of interest of mine because it's actually how I got involved in Chinese medicine in the first place. So I thought maybe it would be helpful for you to know a little bit about my background before you come to my clinic, and I expect you to open up and bear all. So in before 2001, in fact, I had been completely healthy. I've always been very healthy. I've never had any major illnesses, or if I have, I've got over them very quickly. I've always had a pretty good diet, apart from when I was a child and I didn't think I needed to eat anything. So never any health problems. And yet I had at least 2 miscarriages. One of them was called a missed abortion, or it's basically when the baby stops developing, and that was about 9 weeks, but I still had all the symptoms of pregnancy. And I couldn't understand it. There was no explanation. I thought that only happened to people who drank too much and smoked too much and partied too much, and I just didn't do any of those things. So it was a real eye-opener to me, and I struggled to understand it. I also struggled because the hospital said, never mind, just go home and try again. And that was it. I said, hang on a minute, are you saying there's no baby? And I just couldn't get my head around it. And now I know that it's so commonplace for people to miscarry that in medical profession that can be the approach. Just, yes, never mind, you're just one of many. But for me to then go home and try and refocus my life in a new direction was very difficult. And then fast forward to 2001, when I was pregnant again, but it was a very, very challenging pregnancy. And I had hyperemesis, which means I was sick every single day for 8 months. I couldn't keep anything down, I couldn't keep fluids down, and I fainted every time I tried to go out and about. Again, there was no warning for it. I'd been perfectly healthy in between times. My overall level of health and fitness and my weight and everything else was great, but it was just that pregnancy did not seem to agree with me. I couldn't understand why. Sadly, that pregnancy resulted in a full-term stillbirth. So the day of my 40-week scan, I went to the hospital and I said, something happened at 3 o'clock this morning and I think that I'm going into labour, but I'm a bit anxious. And the consultant said, no, don't worry, everything's lined up, everything's fine. And I demanded a scan. And this is what I would say to everybody: trust your instincts and don't be afraid to come forward. Because I had a scan and she said, yep, everything's lined up, ready to go, but actually there's no heartbeat. And that was the day before he was due. So I then had to go and deliver the baby, and his funeral was on Christmas Eve. So from that point on, I decided that if I was going to get up every day, I was going to have a damn good reason to do it. And for me, that was actually healthcare, because in the past, although I'd worked in the corporate environment for multinational companies and I'd flown to meetings internationally and done global training strategies and things like that, it was board meetings, I was bored. It just wasn't fulfilling. And while I was doing all of that job, just as a hobby, I had a treatment room at home where I would do other complementary therapies that I trained in. So massage, done Thai yoga therapy, Indian head massage, and I used to do it just for fun. So this was the turning point when I said, okay, from now on, I'm going to do something that matters. And I went back to study, Chinese medicine, so I got another degree. And then I did postgraduate studies in herbal medicine. And that was really the next phase of my life, because finally I found something that I loved and I could stick with and felt and still feel very passionately about. And I'm very delighted to say that I went on to have 2 very happy, healthy pregnancies and babies. And one of my babies is currently doing his GCSEs. So it's some time ago now. And I can look back on the tragedy around 2001 and say thank you to my little boy, Alex, for that terrible time that I went through, because now I can see why I was sort of given a shove to get on the right track. And what I found in my clinic is very, very early on, I started treating people with fertility problems. And I remember I think I'd only been in practice on my own, not the clinical phase in college, but actually on my own in real life. Somebody came to me who'd been trying to conceive for 3 years, and she fell pregnant within her 6th week of having acupuncture. So sometimes that's all it takes. We look at things in a different way in Chinese medicine. And that's, at the time, it seemed absolutely remarkable. But now I can't say it's commonplace, because there are certainly no guarantees. But for some people who've been given a diagnosis of unexplained infertility, there can be some tweaks that we can make with Chinese medicine that make all the difference in the world. And for people who have got more complex problems and they know they've got an issue, acupuncture, herbal medicine and the right nutrition have all individually been proven scientifically to benefit fertility. And so I love working with people who are going through some of the heartache and challenges and social pressure and emotional trauma of infertility problems, because I know that if we can really help you to be as healthy as you can, that's going to benefit you anyway. And in some cases, if not many cases, I've had people who've cancelled their IVF appointments because they don't need IVF because they conceive naturally. Now, there's no guarantees. There's no guarantees whether you have Chinese medicine or whether you have IVF or anything. So I don't want to set anybody's expectations unrealistically. But what I do want to say is that I really believe that taking a holistic approach to your health can be of tremendous benefit. Talking about some of the research, in fact, if we look at IVF, this is a book that I use. I don't know if that is the wrong way round on the camera. Now, I'm not going to recommend that anybody rushes out and buys it, but it's called Acupuncture and IVF, Increase IVF Success by 40 to 60%. Now, that is absolutely remarkable. And I've seen, so a lot of the protocols in here are the ones that I use in my treatment. I use herbal medicine and I use acupuncture and various modalities from Chinese medicine. So whilst I'm not saying that that will happen in every case, what I do believe is that this can make you healthier overall. And so whether or not you do conceive in the end, you'll be a healthier person for longer. The other thing that I wanted to make clear is, I think for a lot of women, we always assume that the problem, it lies with us, just because the women are the ones with all the complicated bits and the complicated work to do. But actually, I see a lot of men as well with low sperm count, more and more these days. And because a lot of people, for example, a lot of people smoke cannabis in their teenage years, and that definitely seems to have an impact on sperm count. And so whether men have taken drugs or not, whatever the reason for the low sperm count, I find herbal medicine works the best with that. Acupuncture definitely helps and definitely makes a difference, but I think herbs in that case are, I would say, more or less compulsory, or certainly a detox can change the motility and mobility of your sperm. So that's about it really. If you've got any questions, then please email me at clinic@barefootmedicine.co.uk. Otherwise, I hope you find the information on this website helpful, and I would love to see you if you'd like to click on the button below and book a session with me. Thank you.